Hello and welcome to HIMSS TV. I'm Susan Morse, Managing Editor of Healthcare Finance News. I am here today with Chad Peterson, who is Chief Revenue Officer of Orion Health. Hello, Chad.
Hi, Susan. It's great to be with you.
Nice to be with you as well. I was wondering if you can start out by telling us a little bit about Orion Health and your work there, please.
Sure. I think one of the more interesting aspects of my position at Orion Health is that I used to be a customer of Orion Health for many years. I helped to start a few HIEs in my past 10 years or so, and as part of that, I kind of grew into a more of a subject matter expert or a strategy type person. And Orion Health brought me in a few years ago, really for a sales position, but quickly evolved into where I am now as this Chief Revenue Officer for the US. Enjoy it a lot. Yeah.
Excellent. How do HIEs, health information exchanges, fit into the healthcare ecosystem?
Well, I think that they've evolved quite a bit, and that's one of the more interesting things. I think back in 2009, when many of these HIEs were first started, I do acknowledge there were several before 2009, but the majority of the states didn't have any HIE initiatives of any sort before 2009, 2010, and we're sort of thrust into this challenging role of planning and developing successful HIE strategies, which is pretty tough to do. We've seen lots of growing pains and stops and starts at various times for some of these HIEs. But overall, I think the startup phase is over, and many HIEs have proven that they can add value to the various stakeholders and participants that they have in their regions.
The COVID-19 pandemic has changed everything. Has it changed the need for HIEs, increased it, or complicated it in any way?
A little bit of all of the above. I think HIEs are looked at much more closely as a potential solution or a good partner to rely upon when it comes to getting data to the right hands. Particularly, I'd say, Susan, at a state government level. While the response to COVID-19 outbreak and the pandemic was and continues to be very heroic, it identified lots of opportunities of improvement. Some health departments had a close relationship already with their HIEs and were in fairly good shape trying to get data into the right hands of the right people and things like that, while other states simply scrambled to get that data and to get it to the people that were the decision makers and policymakers and really get a good picture of what was going on in their states with the outbreak. We're seeing several initiatives now, Susan, going on across the US with several different state health departments taking a look at that data collection process that they have in place with the various programs or registries that they have, and ensuring that they're as efficient as possible. One thing that we see is as hospitals and state health departments look at the CMS requirements for public health reporting with electronic lab reporting, immunization, case reporting, and syndromic surveillance, the HIE looks like a very solid solution to leverage in the future.
What kind of data are you getting from the HIEs?
It varies, right? It varies depending on what the use cases have been in several of these. So simply an ADT feed is where most HIEs have landed, perhaps a clinical document exchange, rather like a CCD repository or things like that. Others have more discrete data with lab results flowing, other types of documents as well that kind of lend to this overall broader longitudinal view of a patient. If you're able to get that discrete data, Susan, especially the ADT feeds and the ORU feeds, you're able to solve a lot of problems with data collection in these different states that these HIEs are located in, particularly around electronic lab reporting, case reporting, some of those things I just mentioned.
How is that evolving? What's the next generation of this look like?
Well, I think the technology is certainly getting better for the HIEs, and many of them have the ability to add additional data types. We're seeing, of course, claims data, social determinant of health data, things like that are coming into HIEs, which they weren't able to do necessarily in the past, or weren't being asked to do that in the past. And then the use of APIs to exchange data is happening much more frequently, I think. And I think the real differentiator now, though, for this next generation of HIEs is a maturity. They've kind of left that startup phase that they've been in the last 10 years. And there's a certain level of coming of age, if you will. I think in the past, many HIEs perhaps tried to do too many things or be all things to all people in their region. And now we see them working much more closely with other vendors, sometimes by design or sometimes out of necessity. A few years ago, many of the HIEs would have considered these other vendors as competition or maybe as a disruptor. But this next generation of HIEs, the really successful HIEs, unifies the various vendors around a common mission, and they try to benefit the vendor and the providers and most importantly, the patient. One thing that we've seen is really targeting various use cases that may be of most importance to a certain state or a certain region, and really focusing on that as a broader team and delivering a really high quality solution that kind of transforms lives.
You were talking about the sharing of information. Of course, we have the interoperability rule. Is all this spurring more HIE collaborations and information?
It's spurring a lot of things. I think a lot of collaboration, and there's a lot of, I'll call it contraction, if you will, in some ways, or some HIEs are consolidating with each other. They're really looking for that sweet spot, the place they can make the most difference or add the most value in the ecosystem. And for some, that means simply combining with somebody else, maybe combining with an HIE and the ecosystem next door, because the patients are transferring back and forth anyway. Why not work more closely together? I think as these HIEs have evolved, it's important to note also that the traditional HIE vendors have evolved, whether through just a continued modernization of the software. Maybe it's part of being compliant, for example, with CMS requirements, but it's also simply expanding those products and services and working more closely to help their HIE clients be more sustainable.
What's the future, Chad? What are we looking at going forward?
It's a great question. I think we won't have 85 HIEs, I don't think, in the country. That will definitely reduce. I think that you'll see a much more elaborate network of networks, and we'll see HIEs that are solving real problems in their states while contributing to a national effort of getting data to the right place at the right time.
Thank you so much, Chad. It's been a pleasure having you on HIMSS TV.